Welcome to our live stream, Olympic Orthopedics, Unique Challenges. We are joined today by our speaker, Dr. Tamir Bloom, a board-certified pediatric orthopedic surgeon, board-certified by the American Board of Orthopedic Surgery. Dr. Bloom treats children and young adults with a wide spectrum of musculoskeletal problems, including upper and lower extremity deformities, hip dysplasia, fractures, sports injuries, and complex foot disorders. He has a special interest in neuromuscular conditions such as cerebral palsy and spina bifida. He is part of the Pediatric Orthopedic Center in Cedar, Knolls, and is on staff at the Morristown and Overlook hospitals. As a former elite athlete and two-time Olympian in fencing, he has a unique insight into how sports injuries and orthopedic surgeries affect developing athletes. At this time, I would like to turn the microphone over to our speaker, Dr. Tamir Bloom, for opening remarks.
Hi, everyone. Thank you, Ryan. Hi, everyone. Welcome. My name is Tamir Bloom, and as Ryan said, I'm a pediatric orthopedic surgeon at the Pediatric Orthopedic Center in Cedar Knolls, which is in northern New Jersey. And I'm also an Olympian. My senior partner gave me this talk a couple months ago. I wasn't quite sure if he wanted me to talk about my own personal experience, since I was a pretty good athlete, but I also tore my ACL. So I have some unique challenges that I went through myself, or he wanted me to talk about sports medicine. But I'll focus on the latter because I don't want to bore you guys with my story. But as a Olympian, I can tell you that the only thing harder that I've experienced than making the Olympic team is taking care of patients whose parents think their kids are going to make the Olympic team. That's a pretty unique challenge of itself. So let's get started. I have no disclosures. Still upset about this picture, photobombed by the president, former president, in this picture. So somehow I wish I could erase him in the back over there. There he is, President Clinton. But I did get a chance to meet some very nice people during my athletic career. I competed in 1996 and in 2000 Olympics. 96 was Atlanta, 2000 was in Sydney, Australia. I didn't medal, but I did have an incredible time. I fenced epee, which is one of the three Olympic weapons. And there's a couple of action shots of me. So most parents who have young athletes in the tri-state area here have aspirations for their kids to make the Olympics. So I will give you some of my tips and 2 cents of my knowledge about how they can make that happen. And also talk about the pearls and pitfalls on the road to becoming an elite athlete, and some of the things that I've noticed, as well as some of the things that have developed over the last 2 decades in youth sports that I see on a daily basis. So the first tip is we need to have some realistic expectations if we're going to make it to the elite level. Sports still follows the rules of physics, and there's certain physiques that are more suitable for certain sports than others. I really loved gymnastics when I was a kid. Unfortunately, gymnasts are not built for my size, and so I had to find another sport that was more suitable to excel in. In addition, there are individual difference, variabilities in talent, ability, motivation, as well as emotional and activity dispositions. And some of these are innate, and some of these you can nurture as a young athlete, or a combination of the two. But Michael Jordan famously said, "Everyone has talent, but ability takes hard work." I don't agree with this 100%. Not everybody has talent. Some people have more talent than others. If I played basketball every day of my life since if I was a baby, I still would not have made it to the NBA. At least I don't think so, even with tremendous hard work. So the tips include embrace reality. We need young athletes to have some perseverance and grit. And thank you, Dr. Angela Duckworth from the University of Pennsylvania has done a lot of research on this, and you can listen to her TED Talk. Pretty interesting. We need to be able to focus on what matters and prioritize things that are going to help us succeed. We need to target our weaknesses. We need to efficiently manage time and energy, which are both finite resources. And we need to be tough. Tough doesn't mean just being able to endure hardship and adversity and pain, but being able to do what you need to do in order to excel and not doing what you want to do. You need to be able to make the right decisions under stress. We need to constantly be learning and seeking feedback. And you need to be able to think differently. You need to be able to develop training methods that are unique to yourself, as well as tactics and techniques that are going to help you excel. And here's a picture of Michael Phelps doing some type of training conditioning upside down at the bottom of the pool. He certainly developed a whole new training method to become the superstar that he is. And then you also need a strong network of supporters and mentors to guide you and support you along the way. So all that stuff is pretty well known. Probably no new revelations. One of the things that I think is very important in terms of succeeding is to have passion in what you do. You need to love the process of personal development. Each day I get on the ice, I just love it as much as when I first started skating. That's Tara Lipinski, Olympic champion. Same thing with me when I was training. Every time I walked into the gym, I got excited. I couldn't think of anything that I'd rather be doing than training, practicing, and competing. And we also need the purpose, not just the right purpose, but the correct balance of purpose or motivations. Most of us are motivated extrinsically, primarily. We all love to win, including myself. We want stardom, we want medals, we want scholarships and other perks. But to make it to the elite level and to be able to maintain your emotional health, I think it's important to have greater intrinsic motivation than extrinsic motivation. The overall balance should include things that drive you on a daily basis to succeed, including fun, enjoyment, growth, curiosity, self-expression, and passion, as I mentioned. And you need to work very, very hard. This is also no revelations here. Erickson, in 1993, talked about the 10,000-hour rule. This is a common point that's thrown around over the last couple of decades. You need not just to work hard, but you need intense, deliberate, and effortful practice. I'm not sure 10,000 hours will get you to the Olympics in any sport this day and age, but you certainly need to be able to dedicate a significant portion of your childhood in order to make it to the elite level. And this is where most young athletes kind of get it wrong. Let's see if I can advance the slide here. There we go. Okay, so you need to work hard, but not all the time. So you need to be able to rest and be able to recover. If you look at the overall training load that an athlete needs to do in order to improve, it is not just what they do in the gym. It is the overall training load is a combination of stress that they apply to their body and their mind during training, during competitions, plus all the stressors that happen outside the gym. Things like school, things like relationships, things like worrying about if you're going to get enough playing time. All these things are a cumulative amount of stress that help determine your training load. If you subtract the effort that you do or things that you do in order to recover from the amount of stress, and this primarily includes rest, but also participating in other sports, free play, doing things like vacations and yoga, whatever you need to do to recover. And there's a whole science about sports recovery. I won't get into because of time. If you subtract the total stress minus the recovery efforts, not in terms of necessarily time, but in terms of activities and effort, this will this difference will be the total training load. And the reason why this is important is because if you train too much, then you'll move towards the right side of this continuum of training and overtraining versus recovery. So let's just take a look at the different points of the training continuum over here, the overtraining continuum. Ideally, you want to be right over here in FOR. FOR stands for functional outreaching, which is you train hard, you overload your body, you experience a short period of performance decrement, either a few days for a few weeks, and this can include either a training camp or a competitive season. But then you're able to recover completely, and your overall performance and fitness is enhanced. Excuse me. If you continue to increase your training, increase the stress, and or decrease your recovery, then you'll move into the next phase, which is non-functional overreaching. And this is where you increase the stress, you have a period of performance decrement, and this can last for weeks or months. And as a result, or in the end, your performance fitness has not been enhanced. You continue to train and deprive yourself of recovery, then you'll eventually overtrain, which is a period of performance loss, followed by mental health, mood and disturbances, as well as chronic exhaustion. And then ultimately, the last step on this train is burnout. This is where you have no motivation to participate in your sport, and you may have a negative emotional reaction to sports participation. So ideally, you want to be able to hover between this phase and this phase throughout your sports career. And the reason why this is important is because overall, you need to stay healthy at least most of the time. And healthy includes your physical well-being, your physical health, as well as your mental and emotional well-being, as well as other factors we don't quite talk about so much in the sports world, including social, academic, and your financial health. These are all factors. All of these I did address at some point multiple times throughout my athletic career. So as an orthopedic surgeon, I'm going to focus just on your physical health, a little bit about mental health over there, because I think this is quite important. But overall, your physical health, it's very important for young athletes to be able to listen to their body. Most of the time, when things start to go wrong, your body tells you you'll experience pain. And pain is the signal that you are not okay. Something is going on. I think of it as the check engine light. If you're driving a fancy sports car like this one, which I don't drive a car like this, I wish I did, and one of these lights turn on, you're probably going to pull over and get it checked out. Same type of thing. If your body's experiencing pain, it is a sign of injury. It is the body's protective mechanism. Patrick Wall, one of the most famous neuroscientists of the last century, said pain is simply not a sign for tissue injury, but is a primary signal to seek repair and recuperation. And I totally agree. So let's talk about pain caused by tissue injury. The most common type of pain a young athlete experiences is from overloading or repetitive training. This leads to tissue injury on a cellular level, which results in the body's initiating the body's repair process, which is what causes inflammation, and this results in pain. Pain is, again, the body telling you to slow down, to take it easy. And so if you rest, the body's able to repair and the pain goes away. If you continue to train and continue to compete, then you continue to develop tissue injury and inflammation and more pain, and the cycle continues. So as an athlete, you need to be able to determine how much pain is okay and at what point I need to stop, because this cycle is affecting the way I compete. It's affecting my mental health and other problems, as I'll talk about a little later. All right, so let's delve into activity-related pain in young athletes. So I'm gonna stay away from acute injuries, but we'll focus on the most common type of pain, which is activity-related pain. This is Rafael Nadal, one of the top tennis players in the world. 2021, he said, "I don't remember ever playing without pain." I think he's in his early 30s now. And I think that if you're a professional athlete, certainly if you're an adult and you're making the kind of money or on the brink of history in terms of winning tennis titles, I think it's okay to play with a little bit of pain, as long as you're able to perform at a high level. However, when we're talking about young athletes, I think that's something that needs to be addressed. Pain is actually quite common in our young athletes. It is one of the most common complaints that's reported. It's one of the most common complaints that I see in the office on a daily basis. How common is it? We don't have great data. Much of it's probably underreported, but a recent survey of over 200 players, over 100 coaches, about 90% of athletes report hiding an injury in order to continue to play. About 50% of players and coaches have seen players put under pressure to participate when injured, and over half of coaches have had players play when injured. So why are young athletes experiencing pain to such an extent compared to skeletally mature athletes? And that's because they're uniquely vulnerable. They have changing height, weight, muscle mass, flexibility, body composition, surface area to mass ratios, and head-body ratios. And the body is constantly in flux. In addition, they have to undergo a pubertal growth spurt that dramatically changes the biology as well as the psychology of young athletes. And the biological and psychological variation varies obviously between sex as well as between various individuals. And the changes that happen on all of these are not linear. So you have a system that's constantly changing, and you're constantly subjecting different stresses in terms of training loads, and intensity, and competition. So you have the result of that is a system that's quite fragile. In addition, there are different mechanical properties that we see in the musculoskeletal system of young athletes, including articular cartilage that's weaker. They have growth plates around the joints and apophyses that are more fragile relative to the bone, as well as they have decreased bone mineral density during their peak growth. So all of these factors increase the risk of injury. Well, how common are youth sports injuries? There's not a lot of very specific data more recently, but data from about a decade ago suggests that sports injuries are extremely common, and certainly youth sports has grown tremendously over the past decade. So 2014, 5.6 million sports and recreational injuries per year in this country. Most of that's between the ages of 5 and 24 years of age, with the highest rates being in males between 5 to 14 years of age. 2017, there are nearly 3 million emergency room visits from sports-related injuries in children less than, 19 years of age, and that's roughly 8,000 visits per day. And this also includes non-musculoskeletal injuries, such as concussions, but 8,000 visits per day in this country is a pretty high number. Injury rates and types of injuries obviously are going to vary among the age, sports, and sex. The most common injuries that we see by far are overuse injuries. These result from repetitive loading, leading to microtrauma to the musculoskeletal system, most commonly the joints, the muscles, and the tendon of our young athletes. In terms of overuse injuries, about 15 to 70% of all injuries are overuse injuries. The incidence is likely underreported. Most of these are minor, lasting a few days to a few weeks. However, not all these are inherently benign. Here I listed some of the common overuse pediatric sports injuries that we see. Most of these, again, are benign, but there are some pretty serious ones that are going to require athletes to take a few weeks to a few months off from their sport and potentially need surgery. Things such as osteochondritis dissecans, as well as stress fractures. And what are the consequences that in our young athletes from these injuries? Well, again, just focusing on overuse injuries, acute injuries are a whole other presentation just on those, but let's just focus on overuse injuries. Again, most are minor, relatively short period of recovery. However, if you're needing to miss a couple of days or even a week from your sport and you have an upcoming competition that weekend, then having to miss that competition can have pretty significant mental implications, as well as implications in terms of your success as an athlete. If that competition requires you to succeed so you can advance to the next round or to the next level of competitions. Many times, athletes that are experiencing pain from overuse injuries will have a decline in performance, although many of them may not know it, or at least have difficulty in consistent performance in competition. Pain is also comorbid with stress, and this is a complex relationship. We do know that pain may increase the risk of overtraining and burnout in young athletes. About 20% of elite athletes report injury, and this is both a combination of acute or overuse injuries as a result of quitting their sport. And about 8% of adolescents will drop out of sport due to injury or fear of injury. So these are pretty significant numbers. So why are so many of our young athletes getting injured? Well, I think we all know the answer. We have our young athletes training with greater frequency, duration, and intensity. Now you can do a summer sport, train for it in the winter. You can do a winter sport, train for it in the summer, and you can do your sport year round. There are more competitions. Kids are starting at an earlier age. They're specializing earlier in their sport. There's less free play and less time to rest. This is hard to ignore. Our current youth sport environment, we have a culture that's obsessed with sports, myself included. We stress achievement over fun, and there are many incentives to succeeding in sports. Probably the most common one is to be awarded a college scholarship. We have a youth sport industrial complex. About $15 billion is estimated to be spent on the business of sports. This number is probably a decade old, so it's probably grown quite a bit. We have these ultra organized single sports clubs and leagues that run year round, and essentially these leagues and clubs have privatized sports in our young athletes, and they have little to no oversight. There's really no academic gates for most of these clubs, no recruitment guidelines, no restrictions on season length, no restrictions on load, intensity, or frequency of competition or practice. The guidelines, policies, and practices frequently reflect parent and coach personal bias, and there's little to no medical oversight. So where does that leave us? Well, I think the most hot button issue in youth sports is early sports specialization. This is the Tiger Woods phenomenon. Train from a very young age and train really hard and focus on one sport. You're going to be a success. So what we want to know as a doctors is this safe for our young athlete patients? Is it safe to train in one sport from a young age? And does it work? If you look at this PubMed search I did on early sports specialization, really the number of studies has exploded over the last 2 decades looking at early sports specialization. So there's quite a bit that we know, and so I'll present some of the medical data that we know, as well as my unique perspectives and what we have to continue to learn. So let's define what early sports specialization is. One of the limitations in some of the studies that have been done on this is that there's no universally accepted definition. The definition usually focuses on 3 things: the age of the athlete. We're talking about junior high or high school, junior high athletes or younger, ages 12 to 14 and prior to puberty. Next, these athletes are intensively training 8 months or more out of the year, often at the exclusion of other sports and activities. And many times their goal is to achieve either elite status in a single sport or college scholarships, or being able to say that they played on a varsity college team. How many athletes in this country are specializing early? We don't have great data on this. We know about 60 million children participate in organized sports. About 8 million adolescents participate in interscholastic team sports, and about half train on club teams in addition to their school teams, so that they can train year-round and improve their performance and participate in more competitions in their chosen sport. The sports specialization rate varies among different sports and different ages, but hovers between 17 to 40%. So what's the debate with early specialization? Again, the debate is this beneficial, or is this harming our young athletes? And that's been called the double paradox of the body. You need to train hard, you need to train intensely and for a long period of time to see very significant benefits in athletic performance. But if you push too much or too hard, you can fall off the cliff per se. So a lot of the current discussion about this, certainly on the internet or in social media, is anecdotal and employs mostly non-data-driven editorials, commentaries, and reviews. So I'll present some of the data. So potential benefits of early sports specialization. Well, you can't argue with success. Here, 2 of the most famous athletes, well recognized, I'm sure, by most of you, Lindsey Vonn and Michael Phelps. Both of them specialized before 10 years of age. These are some of the most decorated Olympians, not just in the U.S., but throughout the history of the Olympic movement. All right. And where did this early sports specialization start from? Well, it didn't start in this country. It actually started over 70 years ago in the former Soviet Union, beginning of, actually right after World War II, beginning of the Cold War. The Soviet Union was trying to develop elite athletes so as to compete against the world and show their greatness. They developed programs for elite athlete development, which including specialization at an early age, and they reaped the rewards in terms of success at the Olympic Games. You look at their 1960 Olympic Games, Russia, or the former Soviet Union, won 103 medals out of 145 events. They led the medal count that year, obviously, as well as leading the medal counts in 72, 76, 1980 Olympics, 84 Olympics was a boycott, 88, 92. They had a tremendous sports development system. If you look at the most recent Olympic Games, U.S. Was number 1, 113 medals, 339 events. So obviously much more diversification in terms of country represented in the modern Olympics than back in 1960. Many more athletes, many more events. And I think part of the success that we've had is due to early specialization, even if you exclude the success of Michael Phelps. Number 2 in the medal count of 2020 was China. China also has a early sports development system that's quite robust, and they'll probably be leading the medal counts sometime in recent future Olympics is my bet. All right, so let's look at the data. So potential benefits of early sports specialization. When supervised properly, early sports specialization or sports specialization in general can be productive and safe. We know it can improve health and performance, including motor skills, cardiovascular profile, muscle strength, and power, as well as psychological benefits to mental health. Certainly look at these kids down here. They look like they're having a great time. We know that the sports structure and institution benefits of specialized programs can improve coaching, competition, as well as high skill development, as well as early talent recognition that's prerequisite for better subsequent team and squad selection, as well as better structured use of our young athletes' time. And let's now switch over to the potential harm of early specialization. Again, the focus obviously is on overuse sports injuries. If we look at the data for athletes over 12 years of age, the more they specialize, the greater risk of serious overuse injuries. These are injuries that last more than 1 month or cause them to miss more than 1 month from their sport. The risk of injury is regardless of training volume. So we can look at these studies on how they determined more specialization. They basically stratified specialization into low, moderate, or high specialization based on one of the 3 of the following: either training more than 8 months out of the year, choosing a single main sport, or quitting all sports to focus on one sport. So if you ticked all 3 of these boxes, then you were in the highest risk for overuse sports activities, at least based on these studies. If you look at athletes less than 13 years of age, there's an increased risk of overuse sports injury if they either participate in more weekly organized sport hours than their age, or they play more than one sport 8 months out of the year. Again, this 8 month out of the year seems to be kind of a tipping point in terms of your physical well-being. Excuse me, or exceeding more than a 2-to-1 weekly ratio of organized sport to recreational free play hours. Now, these studies are usually done by surveys. Some of these surveys have not been validated, and some of them use surrogate measures of participation, and there's certainly an element in recall bias since they're most of these question young athletes, adolescents, and teenagers. Clearly, more research needs to be done in terms of the potential risk of early sports specialization, but the overall data seems to notice a growing trend towards more specialization and greater risk of overuse injuries. How about mental health? I think that certainly in light of the recent Olympics with the women's gymnastics team, we're seeing more of this come to play on international or national stage. There's mounting evidence that early specialization is an increasing risk factor for overtraining syndrome and burnout, as well as dropping out at a younger age, early retirement, and less time on the national team. The symptoms for overtraining are pretty nonspecific, and I listed them here. Again, if you're overtraining, not getting enough rest, you're going to end up having a significant mental health issues, particularly as you reach this stage of imbalance between stress and recovery. Both of the athletes that I showed you, both Michael Phelps and Lindsey Vonn, since their retirement have gone public about depression, and probably they also have had some of these symptoms at some point in their training or afterwards. So other potential psychosocial harm we don't quite talk about, it's difficult to quantify, at least it's hard to assess in the sports medicine world, is, sorry about that, guys, is the mental harm, both emotional and social. Athletes that train at a young age many times will have a lack of, will complain of a lack of autonomy or lack of self-determination and powerlessness over their lives and not being able to cope with a system that is enforced on them. They face increasing stress and pressure as they develop from adolescent to teenagers, with the increasing competitive nature of sports. They may sometimes develop what's called a premature identity closure, where they have an unquestioning mindset in terms of accepting roles, values, and the goals of others that are trying to push them towards competitive success. Social isolation, less exposure to kids outside of their activity. If you're in the gym all the time, you're gonna have limited ability to participate in other experiences and other people, obviously, as well as this may lead to lower lifelong participation in your chosen sport. What about free play? This is Brooklyn. The picture on the right is Brooklyn, 1959. This is where my dad played baseball in the streets. I'm sure that you won't see this in the United States today. Usually after early childhood, most kids are now outside in the park or in the street playing pickup games. And many times, if you want to see these type of activities, you need to leave the United States and go to different countries. What we don't know is how important are they to your overall physical and mental well-being. Certainly, I think that they do help develop creativity and imagination, which is a very important part, at least in my mind, to the evolution of sports. All right, so let's switch gears one more time. We'll focus on early specialization. Does it really lead to success later, as we all think? Well, there's really little evidence to show that it does, possibly with the exception of sports where athletes peak early, such as gymnastics. There is some evidence to show that it is associated with athletic success, but not at the elite level. And early success does not necessarily predict future success. There's certainly athletes that are late bloomers that are not recognized for their talents early on in their childhood or adolescence. And there's little evidence to support the 10,000-hour rule in terms of sports and developing elite young athletes. If you look at the studies looking at the evidence for early sports specialization and elite status, and this is in multiple sports in multiple countries. And I'm sorry, the slide is a little busy with this table over here, but the overall trend is that elite athletes tend to specialize and increase their training intensity late in adolescence, and multi-sport involvement is overrepresented in world-class athletes, include myself in that. Olympians, at least on the U.S. Olympic team, 97% believe their diversification in sports was an important part of their success, and nearly 90% participated in more than one sport as a child, and over 3/4 of them played 3 sports in addition to their Olympic sports. So the take-home message is diversify early and specialize late. And if you look at what the medical experts say from multiple medical societies, including the Academy of Pediatric Orthopedics and the International Olympic Committee, all of these organizations have had position papers on early sports specialization, and this is their take-home messages. delay specialization in one sport at least until puberty, with exception of certain sports where peak performance occurs at an earlier age. Encourage sport diversification. Limit single sport participation to less than 8 months per year. Limit participation to fewer hours per week than your age in years. So if you're 10 years of age, you shouldn't be doing more than 10 hours of sport per week in that single sport. No more than a 2-to-1 ratio of organized to free play hours per week. And overall, they concluded that benefits to youth sports often are negated by overemphasis on competitive success, leading to overuse injuries and burnout. So what are the solutions to this? There are some sports that have integrated top-down approach, including the Women's Tennis Association, which about 25 years ago instituted the age eligibility rule, limiting the number of competition their female athletes could participate in beginning at age 14, and gradually increasing the rate of number of competitions until the age of 18. Two studies now with 20-year follow-up have shown, both demonstrated that since the institution of this rule, tennis careers have lengthened. There's a lower risk of premature retirement, and this may serve as a model for other sports in terms of reducing burnout, dropout, and early retirement. Okay, so now let's just step back and look at the bigger picture. I think when you're considering early sports specialization for your child, you need to figure out what your sport philosophy is and how do you want to raise your child. And everybody has a different opinion about this, obviously. But the key questions, at least in my mind, are what is your childhood for? What do you want your kids to do? You want them to specialize in one sport or one activity, or should they be explorers? Should they potentially broadening their mind in multiple fields? And this again is a personal decision. I don't think there's a right answer for everybody. And then both for parents as well as our society as a whole, what are our goals with sports? Do we want to be able to optimize public health through lifelong sports participation and physical activity, or we want to develop a few outstanding Olympians or pro athletes or elite athletes? So my perspective is this: I think life is definitely better with sports. I think we should push the limits of human performance, just like we should push the limits of space. We should be going to Mars. But in terms of sports, in a very pure form, sports offers an endless parable of struggle and triumph and victories over our enemies, time, gravity, and the resistance of other human beings, and it creates meaning. So I firmly believe that it is an important part of having a well-balanced life. Not necessarily competitive sports, but being physically active. And injuries are kind of proof that we have come in contact with the real world. We're never going to be able to prevent all injuries, but injuries are going to continue to happen regardless of protocols or rules that we set in place. If no one ever got hurt, we would wonder if everyone were performing hard enough. It tells us that the effort was genuine. So injuries are going to happen. However, I firmly believe that elite selection should be based on merit and not attrition. We shouldn't be burning out our kids in trying to attain elite status as an athlete. And we need to continue to develop the values of sports, probably more so than sports skills. So what are the values that I'm talking about? This is the Olympic ethos. I'm not sure if most of you are aware that there's actually an Olympic ethos. The Olympic ethos has 5 parts to it: the joy of effort, the pursuit of excellence, playing fair, practicing respect, and balancing of body, will, and mind. I think the last one is probably something that a lot of athletes need to be able to recognize as being extremely important. If you're constantly getting injured, if you're having symptoms of overtraining and burnout, you're not following the Olympic ethos. You need to be able to respect not only your body, but also your mental health. So my perspective on early specialization, I'm not necessarily anti-early specialization, as you can tell, but I think that if you know the risks, then potentially they can be mitigated. For example, I mentioned the Soviet system of sports development in the last century. What is not really talked about is that when this system was developed, it was developed in conjunction with physicians, and they had a role in monitoring and optimizing training for young athletes, adjusting intensity, and making adaptations as the athletes progress throughout the first and second decade of life. Their goal was to develop elite athletes, but they also didn't want to destroy their athletes either physically or mentally, because the state has invested so much time and effort into developing them. They wanted them to be successful on the international stage. So I think that greater physician monitoring is important to our young athletes if they're going to pursue early sports specialization with the desire to become elite athletes. I think the young athletes should be motivated to participate in early specialization based on their own desires rather than dictated by adults, which is probably more common the case, although I don't have any data to support that. And the optimal age for beginning early specialization should be individualized based on the chosen sport, as well as the child's physical, social, and emotional maturity. All right, so I'm going to wrap it up in a minute. So to maximize your young athlete's chance of elite success, as well as a lifetime of sports involvement, which I think is as equally as important as their success as a young athlete, we need to have them participate in environments where they can, where the adults who supervise the environment focus on their health as well as their mental well-being. You need to emphasize the ethos of sport that I mentioned. And in addition to teaching kids how to win, we need to teach them how to deal with loss. We need to teach them how to deal with failure, bad luck, injury, recovery, and the consequences of taking calculated risks. The athletes that make it to the elite level know how to deal with these issues and are able to incorporate them into making them even better athletes. We need to listen to our young athletes. We need to monitor for signs of physical and psychological injuries. Some of these common signs include pain that increases with activity, any changes in form or technique during practice or competition, decreased interest in practice or competition, and recurrent injuries to similar parts of the body. One of the things that I ask young athletes when I suspect they have been overtraining or overreaching, non-functional overreaching, is I ask them, can you remember the last time you had a day off of training? And this is a very easy way to see, to get a handle on how much recovery they're having to determine their overall training load. And most of all, our young athletes should be having fun. So I'll leave you with one final thought. I was going to read this to you, but some of it is covered. But anyway, this is a recent picture of a friend of mine. I didn't ask her permission to use this picture. That's why I whited out her face. But she is also a fencer, one of the most decorated, well-known fencers in U.S. history, also a member of the U.S. Olympic team. And she first entered the fencing room when she was 3. And she recently started taking up the sport of skiing. And you guys can read the top part here, but it says, part of learning something new as an adult is that you can do the activity as much or as little as you want and how you want. There's tremendous freedom and joy in learning a new sport, and part of it is from having the sport be your teacher. And this is something I think you shouldn't just experience that as an adult, but you should have the fortunate ability to experience this as a child. So I'll leave it at that. I think we're doing okay on time, and I think we have a couple minutes for some Q&A. All right, Ryan, are you there?
Yeah, I'm here.
Okay.
We have one question in there right now. I sent it through the chat as well for you to, if you want to read it out of there, I could read it back to you.
Okay. Let me see the chat there. Okay. All right. Can you address how bone density changes DEXA scores as adolescents progress to young adults? Same question with added complications of having diagnosed with growth hormone deficiency and having been replaced by growth hormone deficiency since 18 years of age. Does it change bone turnover and density curves? So I'm not the expert on growth hormone supplementation. That is something that's probably best addressed by the endocrinologist. I think that it's important to know what this individual is on growth hormone for. There are multiple conditions that can cause growth hormone deficiency, but I'm not sure I can give you a good answer to changes on DEXA scores in adolescence. I can tell you about DEXA scores in Olympic athletes. I'm familiar with that literature, but unfortunately, this is a bit beyond the scope of my my knowledge.
So we've got a few minutes left here, Dr. Bloom. If there's anything else you wanted to cover, well, we could wait for a few questions, or you're welcome to wrap it up if you'd like.
Yeah, I'll just wrap it up. I think this talk will be posted on online at some point.
Correct.
That's correct. Okay. All right. Yeah, I think that'll be fine. I think I can take questions or comments once it's posted online.
On behalf of Atlantic Health System, Morristown Medical Hospital, Pediatric Orthopedics, I would like to thank you for your participation in today's event. You will now be redirected to the post-event survey requesting your feedback. Please take a moment to complete this survey to receive credit for providing feedback and attending today's webinar. This concludes today's stream. Thank you and have a great day.